Hi everyone, I did my seminar paper on professional boundaries in nursing. These are some objectives of this presentation, mainly to understand what is professional boundary and where it implies to. So what is professional boundaries? By definition, it's the limit that allows a patient and a nurse to connect safely in a therapeutic relationship based on the patient needs, which means that whatever a nurse is doing is to help that patient. Whatever she does is aligning with the care plan, and all her action is intent to meet the therapeutic needs of that patient. So these are some examples of what are some healthy boundaries. It is really important to understand what are healthy boundaries to distinguish what are boundary violations. So healthy boundaries are framework within which professional nurse and patient relationship occur, and it is those limit that makes the relationship safe, and it makes the services valid for a patient and for a nurse to give and a patient to receive. To understand what is professional boundary or the professional behavior of a nurse, this is a really helpful graph that I found, and it really underlines what is the expected behavior of a professional nurse. If we look at the right side, it's the under-involvement where a nurse is being distant or neglecting their patient, and in the middle we see the zone of helpfulness where the patient and nurse is in a therapeutic relationship, and on the other side we're seeing the over involvement. This is where all the boundary violation, boundary crossing are happening because the nurse is over involved with the patient. It can be disclosure of personal information, it can be exchanging of gifts, money, and it can also be sexual misconduct toward the patient. So it's important to understand why boundaries should be maintained. The reason why boundaries must be maintained is because it's to promote patient care. When nurses are practicing patient care, they are actually promoting the code of ethics. They are respecting a patient's right. They are doing no harm. They are putting the needs of the patient above their needs, and it's about the service is about being respectful and conscious of the need of the patient while giving the care they are seeking. So let's talk about boundary violation. By definition, boundary violation is action that actually cause harm to patient or the family member or even the nurse or the nurse practitioner. So some examples of boundary violations, it can be physical neglect, it can be sexual abuse, it can be emotional or financial exploitation of the patient or the patient's family member. In this slide, I put in a very common mistakes happen among professionals, nursing professionals, is to become too friendly with the patients. It's always recommended not to become too friendly or friends with the patients, because when that happens, it creates an expectation from the patient side that, oh, you will do whatever they want us to do regardless. So it's just really important to keep that boundary intact, so patient is not expecting too much from the nurse, and keeping the exchange balanced. This is another example that complicates professional boundaries in nursing. It's really important to not share any personal information with the patient, because at that point we are putting ourselves to disclosing our information, and making ourselves vulnerable to the patient. Not most of the time, but it can happen that our safety is jeopardized when we are sharing our personal information with the patient. So whenever a nurse is in dilemma that if they are in the verge of boundary crossing, or they have some concern about boundary issues with patient, these are some questions they can ask, like for a self-assessment, to make sure, like they are not crossing any boundaries, or they are not doing any violation with the patient. For example, like asking questions like whose needs are being met, or is this my client's best interest, or even discussing any concern with the manager or the preceptor, like I'm having this boundary issues with my patient, really helps like navigate a nurse through like to make professional boundaries healthy boundaries. So whenever a nurse is going through any dilemma about boundary crossing, these are some tips for them, like just to reassess and see if there is anything they can improve, and always being aware of their behaviors, being observant of the behavior of other colleagues, and always thinking the best for the patient, and intending no harm really helps keeping those boundaries straight. So next, in the next few slides, I have some questions to make sure I have delivered the message properly to you guys. I'm just gonna ask the question and see if you guys can answer them for me. The first question is, when referring to the relationship between the nurse and patient, boundaries are. The correct answer is D. It's the limits that define the nurse and a patient relationship. The second and last question of this presentation is this one. Which is one of the clearest signs that a boundary violation has occurred in the nurse-patient relationship? The correct answer is again D. When the needs of the nurse are being instead of the patient is when boundary violation is happening. Thank you all for listening to my slides. Have a nice day.